Why is it that the only options most pediatricians offer for chronic ear infections are antibiotics or tube surgeries when there's so many time-tested natural options that you can try first? Well, these remedies, they've been around for a long time and they help provide pain relief, they reduce inflammation, promote drainage, and they work to not just help the child get past an acute ear infection, but prevent further ones as well. So this video today, it's for moms and dads who are looking for relief from congestion, ear infections, and just overall immune struggles. We get it. Those sleepless nights, they are long and hard, and seeing your kid in discomfort, it just yanks at your heart. But if you can win these battles naturally the first time around, the odds of these challenges becoming chronic or recurrent are so much less. Sure, rushing to antibiotics will give some immediate relief often, but they don't address the root cause, and actually it drives that challenge deeper into the body and makes the cycle tougher to get out of every single time you're using an antibiotic. So, how to correct the root cause of ear infections is exactly what we're going to talk about today. And that all starts with what we call the plumbing or the drainage of the inner ear. And that drainage process occurs from the proper signaling and communication from the central nervous system, or the brain in particular, and the body's immune system. So just this week, we had a mama bring her sweet 2-year-old twin boys to the office for help with some chronic ear infections they've been battling. Their story is one that we hear on a weekly basis. They had multiple ear infections with multiple rounds of antibiotics. Mom actually told me that she lost track of how many antibiotics they'd been on since birth. They both had tubes placed at the same time. The infections decreased initially, however, they still had to use those antibiotic drops on occasion. And now that the tubes have started to fall out, the ear infections are back. And mom does not want to go down that road again with another tube placement that may not work. So, let's talk about ear tubes for a second. The number one issue that really causes ear infections in the first place is the buildup of fluid within the ear, right? The entire ENT, respiratory, and lymphatic system, they work just like the plumbing in your house, in that it's all linked together. So not only do the nerves and the muscles of that inner ear need to be working well to move fluid along, but it's got to keep moving not just through the ear, but through the entire neck, the lymphatic system, and throughout the entire body. Think of it this way. So just like a clogged drain in your home can cause the buildup of just junk and crud, it's honestly the same thing happening in your child's inner ear, in their throat, and into their lungs. If the body can't expel those viruses and bacteria, then it becomes chronically congested with them, and that leads to nonstop inflammation and just recurrent chronic ear infections or other respiratory illnesses as well. And that is why any natural ear infection remedy, it must first address that poor drainage and get things moving. And that's where tubes can fall short. Sure, they create an opening for drainage to occur while they're in, but once they're out, that plumbing issue caused by the underlying nerve tension most often will still exist. Unfortunately, the natural remedies that you'll learn about in today's video are not the kind of information that you'll be told about in your standard pediatrician or ENT's office. So let's briefly talk about today's approach to ear infections. So many years ago, the AAP and the CDC approved, it's called a watch and wait guideline for ear infections. Great news! Yet, when you review this 2-page document on the CDC's website, you'll see that yes, they do indeed recommend at least 2 to 3 days of watch and wait before any antibiotics are prescribed. But they don't offer any recommendations for treatment options in lieu of antibiotics besides ibuprofen, Tylenol, fluids, and rest. Just like every single medication out there, ibuprofen and acetaminophen, they come with plenty of risks themselves, like weakening the immune system when used multiple times, but especially when used as a young child. So what's really exciting for parents is this. The natural remedies that we're going to talk about are classical remedies that have been around for years, and they've helped countless kids break the endless cycle of ear infections, antibiotics, and ear tube surgeries. The short list of natural remedies for ear infections can include many, many things, but my favorites: warm or cold compress placed directly on the ears, rest, vitamin D supplementation or lots of sunlight exposure if it's the summertime, distraction, salt water, hydrogen peroxide, garlic and ginger drops, other naturopathic ear drops. The co-op has a ton of really good options, and changing sleep positions. So most parents, they've tried some of these and they absolutely can be effective and helpful during an infection, but if your child has had multiple infections in their lifetime, we want to look deeper at what can be done to address the cause. So I'm going to dive into neurologically focused chiropractic care and how it is key for not only drainage, but for the proper signaling and communication of the entire immune system. So finding the root cause begins with a deep look into your child's history. And here's what we continually find in children: who struggle with chronic ear infections. 1. Birth interventions and trauma, such as forceps, vacuum extraction, induction, C-section delivery. Health challenges as an infant, such as colic, reflux, torticollis, constipation. Antibiotic or steroid-based medication use within that first critical year of life. And lastly, but definitely not least, a diet that includes sugar, processed foods, grains, gluten, dairy. Yes, this includes baby formula. Check those ingredients. All of that stuff is in there. So each of those early stressors, it increases the tension and the stress on the nervous system, leaving it stuck in a more sustained sympathetic fight or flight response. And that sustained sympathetic response, what we call subluxation within the chiropractic world, that increases the tone and tension on the soft tissues and the muscles in the upper neck. And that includes this muscle, it's called the tensor veli palatini, which then gets too tight and wound up, and that limits the proper drainage of the eustachian tube or of the ear canal. And not only that, but that sustained sympathetic tone, it creates a condition within the body called dysautonomia. And this leaves the entire body into a more inflammatory state, and it just weakens the entire immune response as a whole. This leaves the ears and the immune system facing two main problems. So one, first, being unable to fully drain the fluid from the ears, and then two, just a chronic pro-inflammatory or weakened immune state. But the good news is, chiropractic adjustments are designed to help with both of these. So neurologically focused chiropractic, it has been shown to have an incredible impact, not only on the prevention of ear infections, but on helping kids just to get better when the ear infection is the worst. So in retrospective studies out there, 93% of kids who saw a chiropractor during an active ear infection improved without having to use antibiotics. This is why we tell all of our parents to bring those kiddos here first. Add in a boost adjustment to their schedule, and the odds are you'll be able to skip the antibiotics completely. So, back to my story. After we took a deep dive into those twins' birth stories and early childhood challenges, we found they had a stressful pregnancy that resulted in a preterm delivery via C-section, and they were on CPAPs for an extended period in the NICU. They spit up a ton as babies. They were delayed in sitting, crawling, and walking motor milestones. When we reviewed their insight scans, one thing was glaringly obvious, and it was identical in both boys. So their upper cervical region up at the base of the neck up here, right around those muscles that help drain from the sinuses into the neck's lymph nodes, it was holding so much fluid where it shouldn't be. There was a ton of stuck tension there. So we took the boys' history information and those scan findings, and we designed care plans specifically for them. And we cannot wait to watch that stuck stress and tension just disappear on those scans as they progress through that care plan, because we know how much better their lives will be when their plumbing systems can fully drain. Yes, neurologically focused chiropractic care may not be on every Google search result, yet we know who owns Google. Still, it has proven very effective in helping children just get past the cycle of chronic ear infections. So, if after hearing the twin story and learning about neurologically focused pediatric chiropractic, you think that subluxation may be playing a role in your child's chronic ear infections, we would love to help. So send us a DM, comment below, or just call the office to get your child's scan scheduled and make ear infections a thing of the past.